Sally, for our viewers out there that don't know who you are, tell us a little bit about yourself, your work, and how that might actually connect with vaping.
I knew I wanted to go into psychiatry. Unlike most medical students who take medical school to figure out what kind of specialty they want, I knew I wanted to do psychiatry because it ranges from, molecules to Shakespeare. I mean, it's just an amazing range of really frameworks of analysis by which you can interpret human behavior.
A lot of researchers that are inside the e-cigarette space say that those smokers who absolutely aren't going to quit, they can't quit, they've tried to quit and they're just unable to through all the traditional methods, those are the ones that are more likely to vape. And they're also the ones that are more likely to die if they don't.
There's no question in my mind there are these genetic differences that make a substance more rewarding to some people and the withdrawal symptom more intense. Also, people self-medicate. There's no question about that. When you're talking about an intoxicant drug, and that's not nicotine, you have a whole different set of consequences to deal with. And they're immediate. When you're dealing with nicotine, or really, it's not nicotine, it's not the problem. When you're dealing with smoking, the consequences are delayed, and that's always a problem for behavior change. So I do think that many smokers, in fact almost most smokers, could quit, but for some, they don't have those intense negative consequences. They're not losing jobs, their wife isn't leaving them, this kind of thing. Plus, they have to be so vigilant every minute of every day that it just probably takes up too much psychological energy, and they say the heck with it. And that is exactly why vaping is such a godsend for people like this, because it provides the medication, or I should say the substance that they're looking for, the nicotine, and also the whole ritual of smoking, which is very reinforcing, and over time, almost in some ways can become the thing that one's addicted to, because nicotine itself is actually not incredibly addicting. It is, there's no question it's an addictive substance, but it is not overpoweringly addictive, but it's the whole constellation of behaviors and sensations that go with it that's extremely reinforcing.
You are talking here at the SFATA event, and tomorrow, from what I understand, it's going to talk a little bit about the hypocrisy of harm reduction. What is the hypocrisy of harm reduction in your mind?
Let's say the inconsistencies. I guess where you're from, Canada, and specifically Vancouver, one could say that's almost ground zero of this inconsistency or hypocrisy. What I mean by that is that for certain kinds of drugs, like heroin and opiates, that community has frankly bent over backwards to erase the harm as much as they can. And the form that the accommodation takes are needle exchanges. For the record, I think that's a fine thing. Certainly, control of AIDS is incredibly important. And injection centers where people can come and inject, and if they were to overdose, there's staff that can revive them with Narcan. Even heroin distribution. Now, whether you agree with this or you don't, the fact is it exists in a city that is vigorously skeptical of, opposed to the whole vaping enterprise, which is shocking. Why is heroin harm reduction okay, but nicotine harm reduction is somehow anathema? I mean, that makes no sense.
Why do you think that's happening, that disconnect? Well, is it on purpose, or?
I'm not sure how conscious it is, but a lot of the people in public health are also fairly puritanical, and a lot of these people are armchair public health experts. I mean, they're in an ivory tower. So I don't think they even get their hands dirty in the real world to understand that there have to be trade-offs.
You wrote a book. What was the title? How Politically Correct?
Yeah, it was PCMD, How Political Correctness is Corrupting Medicine.
What does that mean? And are there lateral relationships here to what we're seeing in vaping?
Yeah, I do think so. I define the word political correctness as an orthodoxy intended to maintain a victim status. So that theme was present in every chapter of the book, and one chapter was on public health. In fact, there are various victim classes in society, anointed victim classes.
A lot of vapers believe that the science on vaping is to be kind, not true, to be harsh, purposefully misleading. Is there some truth in that? And if so, why is it happening?
Some of it is misleading, there's no question about that. Is it purposeful? I don't think purposeful to the extent that these researchers are thinking, how do we warp our data so that it fits our agenda? I mean, frankly, they might be, but somehow I think this is all part of that kind of intuitive process. That is how they interpret their findings, because that is their general perception of
The world around.
and of vaping in particular.
You mean a prejudice towards vaping, or that vapers are not in the anointed class, a victim?
I'm just speculating here, but somehow I don't think they think vapers have faces. I think they're much more interested in vaping, nicotine. There's a lot of cover for certain scientists that the CDC, our lead agency on public health, provides. I mean, they have done all the things that, frankly, I think are undermining the success and the promotion of e-cigarettes.
How does it make you feel being a scientist, a part of this group of people?
Well, it's enormously frustrating, and I do think this may seem excessive, but I really think that there should be an oversight hearing in the House on the CDC's treatment of this issue. You know, when you're talking to someone who's adamantly opposed to something, but you could show them, you know, paper after paper and data upon data that all their anxieties are not illegitimate, but they're not founded. For example, doesn't appear to be any gateway effect. Should we continue to study this to see if maybe there is? Yes, and even if there is, that still raises the question of, you know, how do you balance the concern about children with the concern about smokers? But the point is, after collecting data for 5 years, the CDC has not found a gateway effect. If you looked at the CDC page, you would come away, if you were a smoker thinking of switching, you would be more hesitant than you might otherwise be if you knew nothing and were trying to get at the truth, because if you read a lot of headlines, you'd certainly, again, be alarmed. That's how serious I think this kind of misinformation is, because smokers who would think of switching, who already switched and worry, oh my gosh, if this is just about as bad as what I was doing before, I'll go back to what I was doing. But it's not, and it's a lethal misinterpretation, and one that is being fostered by our lead government agency on public health.